Minoxidil is one of the most trusted and proven hair loss treatments in the world. It's been on the market for over 3 decades, helping millions of men and women slow down thinning and regrow fuller, healthier hair. But did you know that there's both a topical and an oral pill version of minoxidil? The question is, does one work better than the other? And which one is right for you and why? In this video, we'll break down the science and explain how both forms of minoxidil work. I'm Dr. Vic Khanna. I'm a board-certified dermatologist with over 25 years of experience here in the Chicago area. Our team has helped thousands of men and women address hair loss, from early prevention to advanced restoration. What is minoxidil and how does it work? Minoxidil was originally developed as a treatment for high blood pressure, but through testing, doctors noticed an interesting side effect: new hair growth. Minoxidil works by widening blood vessels in the scalp. It's called vasodilation. It improves blood flow, oxygen, and nutrients to the hair follicles, and it helps prolong the anagen phase of hair growth. At DSI, we look at minoxidil as one tool amongst many. Whether topical or oral, it's about activating viable follicles and protecting what you still have. Topical minoxidil is the tried and true standard. What is it? It's a foam or a liquid. It's directly applied to thinning areas on the scalp, temple, or crown area. This is the FDA-approved form for hair loss in the United States. Now, what works well with minoxidil? It targets specific areas directly, and you can apply it right where you need it. And because it's topical, there are fewer systemic side effects because absorption into the body is low, and it's ideal for thinning in a person who prefers to have less systemic exposure to medication. Now, what's not so great about it is you have to be consistent with it. You have to apply it once to twice a day, and occasionally there could be irritation, redness, itching, flaking as a side effect. Now, the effectiveness of minoxidil depends in part on the scalp enzyme activation, meaning not everybody converts it equally well, so it's a bit variable between people. At DSI, we often begin with topical minoxidil for patients in early stages of thinning. For example, stage 2 to 3 on the Norwood scale. We'll monitor results for 3 to 6 months. We'll assess the tolerability and the patient compliance and pair it with other treatments like laser caps or finasteride as needed. The re-emerging option of oral minoxidil, and let's talk about it. Oral minoxidil is a pill taken once daily or as prescribed, which distributes the minoxidil systemically. Originally, minoxidil was introduced as an oral blood pressure medication. When it was discovered that it treated hair loss, it was developed into a topical solution, and that became and remains the primary FDA-approved treatment that's available for hair loss in America. However, the oral version of minoxidil is having a reemergence in the hair loss market because it can provide an effective solution when the topical treatment isn't adequate or effective. It's easier to take because it's in a pill form rather than a topical solution. Some studies suggest it improves hair density, especially with larger thinning areas, and it's beneficial for patients who don't tolerate the topical or have a minimal response to it. Because it circulates through the body, there's more potential for systemic side effects, like fluid retention, dizziness, unwanted hair growth on the body or face, and it can change the blood pressure and heart rate. It requires medical supervision due to some systemic risks. Now, it's not FDA approved specifically for hair loss in the oral form, so a doctor-led decision is important. At DSI, we consider oral minoxidil when topical minoxidil and other first-line options have been tried, but the response is suboptimal. We also recommend minoxidil when a patient prefers a simpler routine by taking a pill versus a twice-daily topical application. And we have to make sure that there are no contraindications like heart or blood pressure issues. We pair oral minoxidil with other therapies like finasteride, dutasteride, laser, PRP to maximize the outcome, and we monitor the side effects closely. Now, how DSI helps patients choose in comprehensive evaluation? At DSI, we assess your scalp health, your hair loss pattern, your medical history, including your blood pressure, heart health, and what other treatments you've used and what other lifestyle issues you have. The trial period and monitoring. If you start topical minoxidil, we'll monitor the adherence. We'll take scalp photos and imaging at 3 to 6 months. We will adjust the treatment if needed. If a topical isn't sufficient, or if you have a large thinning area or you're not tolerating it well, we may propose switching or adding oral minoxidil under supervision. Regardless of the topical versus oral path with minoxidil, at DSI we often combine minoxidil with finasteride or dutasteride, laser caps, or PRP, depending on your Norwood stage to maximize your results. For oral minoxidil especially, we monitor blood pressure, heart rate, signs of fluid retention, or unwanted hair growth. Some patients prefer the ease of a pill. Others prefer topical treatment and less systemic risk. We tailor to your preferences and medical safety profile. When to consider one versus the other? Well, we start with topical minoxidil. If it's early stage of hair loss, if there's great scalp tolerance, and you're willing to apply it twice daily and you have no medical issues. Now, we consider oral minoxidil if you've tried topical minoxidil and the response is suboptimal, or if you have a large thinning area on the crown or vertex or if you need a stronger effect, or if you prefer the pill form and you are medically suitable for systemic therapy. Sometimes we combine or switch later, and it's not either or forever. At DSI, we may move from topical minoxidil to oral minoxidil, or use a combination as part of a broader plan. Both forms of minoxidil take time to work. You may see initial shedding, what we call a shock shed, as dormant follicles cycle out. Now, visible improvements start typically around 3 to 4 months, with full effect around 6 to 12 months. Now, consistency with using the medicines are key. Stopping minoxidil topically or orally will likely cause you to lose the newly gained hair follicles and revert back to your prior state. Now, it's important to have realistic goals. At DSI, we emphasize improve and preserve rather than perfect full head of hair. Follicle viability, donor supply, and scalp health all matter. And adjunct treatments also matter, especially if you're on oral or topical minoxidil. Combining it with other treatments like laser caps, oral medications, PRP, hair transplant can boost outcomes. When it comes to oral versus topical minoxidil, there's no one-size-fits-all answer. Both are effective, and the best choice depends on where you are in your hair loss journey. It depends on your medical profile, your lifestyle, and your response to treatment so far. At DSI Hair Restoration, we guide you through that decision, and we tailor the therapy to your needs, and we monitor you to make sure you're getting safe and you're getting effective results. If you found this video helpful, please hit the like button, subscribe for more hair health insights, and schedule your consultation with DSI to get your personalized plan. We'll see you in the next video.